Excuse me. So, if you've ever had neck pain, and when your neck pain gets aggravated, you have felt like your neck pain is traveling up to the back of your head and then to the sides, and basically manifesting as a full on headache. And you have also noticed that when your neck pain is relieved, then your headache goes down. If that is the case, then you might be suffering from cervicogenic or cervical headaches. Now, in this video, we are going to look at what are cervicogenic headaches and how is it that the stress can cause cervicogenic headaches or cervical headaches. Now, we're talking about mental and physical stress because, to be honest, they can both manifest in a similar way when it comes to your cervical spine and headaches. Now, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs to manage their spinal, that is back and neck, and joint pains. And I do this by giving you simple exercises, easy lifestyle changes, some low toxic, natural alternatives to your for your everyday use, and some simple tips, tricks, and hacks. All right, so let's get back into the topic for today, which is, can stress cause cervicogenic headaches? Now, if you have cervical problems such as, say, a disc bulge or a stenosis or arthritic changes, that is degeneration or osteoarthritis in your cervical spine, then these cervicogenic headaches can be a problem. However, without these neck issues as well, you can have cervicogenic headaches. Let me just give you a brief introduction to the cervical spine anatomy in order to understand how you get cervical headaches. Now, your cervical spine, that is your neck, is made up of seven vertebrae which are stacked on top of each other. There's a disc in between them, and on the side, these seven vertebrae, between every two vertebrae, there are some joints on the side of the spine. From the spinal cord that travels through your spine, there are nerves exiting at every level at that joint on the side of the spine. So between every two vertebrae, basically, there's nerves coming out on your left and your right. And when these nerves are irritated or pinched due to any reason, they will go and manifest as a nerve pain in that area. For example, if you divide your cervical spine into two halves, so you're looking at an upper to mid cervical spine and mid to lower cervical spine. If you are looking at the nerves in the mid to lower cervical spine, if they are irritated or pinched, you will have heaviness in your shoulders, can go into your arms all the way up to your fingers, depending on which the nerve at which level is being irritated, right? So every specific nerve that is exiting your cervical spine is going to go and supply a specific area in your upper limbs, that is your arms, all the way up to your hands. Similarly, when you look at the nerves from your upper to mid cervical spine, that is from your hairline to about the middle of your neck here, if these nerves are irritated or pinched due to your disc issues or stenosis and the other reasons I mentioned earlier, if that happens, then these nerves will go and start giving you that headache. So this will basically start as, say, heaviness going up the back of your head here, and it will also travel to the side. It is possible that you can get this headache coming into your temples and your jaws, that is this TMJ joint here. You can also feel it behind the socket of your eyes, so it's like deep from, like from behind your eyes, right? So this is a very brief overview of the cervical spine and how it is related to the cervicogenic headaches. Now, what happens with stress? Now, when you're stressed or angry for that matter, what is your position? You're not happy and smiling, and you're not relaxed like this. Usually we are all tensed up and you are slouching forwards. And most of the times, people, when they're angry or stressed, they will have the head poking out as well. Now, this is a position in which there is a lot of stresses, physical stresses on your cervical spine. This is also a position in which you're going to have spasm or tightness in your neck muscles. Now, what will happen is when your neck muscles are tight, especially if you already have pre existing neck pain because of whatever reasons I mentioned earlier. The nerves in your upper to mid cervical spine, when they get when they are lying under those tensed muscle, they get pinched, they get irritated, and that manifests as a cervicogenic or cervical headache. So if you want to address your cervicogenic headaches, obviously if it's the stress is the cause, then you need to do a bit of stress management, which I'm not going to cover in this video. I'm sure there are lots of videos out there. However, there are three aspects of managing your cervicogenic headache. One is to manage the headache at the time of onset and during the headache. What can you do during that time? Second is to manage your neck pain. That is because it is originating from your neck. And the third one, which many people tend to overlook, is to manage your mid back, especially your posture. And if you have a posture where you are slouched and slumped, then obviously you will have changes and most probably pain in your mid back as well. So you need to address that thoracic spine. So these are three components of managing your cervicogenic headaches. If you are looking for simple solutions to manage your cervicogenic headaches, there's a free training in my community that I'm starting tomorrow. However, if you are watching this video in the future or anytime after it is recorded, and you're not able to get into the community to attend the free training, it's okay. You can join the community at any time, and the training lives there. So once you join, you have lifelong access. I will leave a link in the description of this video to my free community, and you can join from there. If you're watching me on Instagram, the link is in my bio. Alrighty, I hope this was useful. And if you do have cervicogenic headaches or cervical headaches, or you suspect that you have these, or even if you have neck pain, jump into the free training, and that should be quite helpful for both the issues because we are addressing neck pain as well as cervicogenic headaches in the training. Alrighty, if you guys have any questions for me, any comments, please drop them below the video and I'll address them for you.